everybody. As I said, Patrick's on his way, so he should be here shortly. He might be in the parking lot, I'm not sure. So I'll go ahead and take roll, and then the order of, we're refiguring the order on the agenda this morning a smidge. So let's see, sorry, I see Matt, good morning, and Jill, and Scott's there. I'm going to mute that person. And I see, is Marcia or Margaret, are you there? I don't think so. And I see Tammy, good morning, and Sarah. Patrick will be here shortly. John or Lynn? I haven't seen them yet. They may join us in a moment. And I see Andrew is here too. So we have members this morning, we have a provider that wanted to give some input on the physician associate concept. And she's seeing patients today. So Scott and Patrick agreed to kind of flip the agenda for her just so she can say what she wanted to say and get on to see her patients. So with your indulgence, this is the physician associate concept at the bottom of the agenda. And we have Rachel Stapler with us. If you want to go ahead, Rachel. And
thank you so much. I really appreciate everybody being so accommodating to my schedule this morning. I've got 25 patients on my schedule, so thank you so much. For those of you who haven't met me, my name is Rachel Stapler, and I'm a physician associate. I'm in Coos Bay. I've been in practice for almost 15 years in internal medicine and pain management, occupational medicine, as well as emergency room. And I've been providing care for the last almost 13 years, and I've seen some wonderful improvements in occupational medicine come about that has been facilitated legislatively. But I think there's also some left to really heavily be considered. As a PA, we have reduced time and length of care that creates a decrease in continuity of patient care, which increases patient stress when transitioning to another provider, since we only have a limited period of time, which is inequality compared to our other colleagues. It's an antiquated and unbalanced process, which creates more time loss and financial loss to the workforce and to employers. Patients aren't able to access other providers in an expeditious fashion, which ultimately creates more time off and an ineffective process. By allowing PAs to have a longer term of care, it will improve patient outcomes, decrease time off of work, fiscally decrease time spent through the workman comp process, and overall better patient outcomes clinically as well as fiscally. Occupational injury clinician for the Oregon State Police for the last almost 2 years. Over the last 14 months, I've had over 20 police officers, forensic medical providers, and general employees on workman's comp injuries and exposure claims. So this is something that's a huge part of my practice. It's really impacted my practice, my staff, and my patients. A number of the claims are also psychological injury, and the antiquated process that creates reduced time with a patient has created an incredible amount of stress and anguish for my patients, resulting in text messages at 2 a.m., 12 a.m. for patients in distress. It really creates an uncertainty and a lack of credibility when we're having to trade out providers for these patients. And it creates an imbalance in their care as well. Of note, as most people are probably aware, PAs are no longer supervised status in Oregon. We're actually a collaborative process, which I think really aids and assists to being able to provide longer aspect of care for patients. I really appreciate everybody's time, and please feel free to ask me any questions that you've got.
So I see Tammy's hand.
Thank you, Scott. Hi, Rachel. Thanks for coming. So you're a PA, and how long right now do you have attending physician status?
So attending physician status for 90 days or less.
90 days. And then the nurse practitioners, how long do they have attending physician status?
Up to 180, double the time that we do.
Okay, so are you asking, is your concept, I mean, we don't have any language here, so I just want to make sure I understand your concept, is to jump up to the 180 equal to the nurse practitioners?
Yes, ma'am.
Okay, thank you. That's all I had.
You.
Thanks, Scott.
Do we have any other questions or comments? Not seeing any. Thank you very much for your time. Best of luck on the day ahead of you.
Thank you so much.
Okay. Just looking to see if Lynn or John or Marcy or Margaret joined us. Little tiny boxes on my screen are very hard to see. Doesn't look like it. We'll need to wait for Patrick to get here to do the minutes, so we'll pop back to that. I don't know if anybody else was wanting to speak on the physician assistant concept. Taylor, were you wanting to say anything else?
Just really quickly, so Taylor Sarman and I from the Oregon Society of Physician Assistants. So just we're working to get the legislative language back and drafted, but Tammy, you're just jumping from 60 days to 180 days is exactly what the bill will do. And so we just wanted to give you all a heads up. And as soon as we have the legislative language back, we'll share it with you all. But there should be no surprises. It's just that simple. So.
Taylor.
And I guess I had a quick question. So it sounds like maybe the cause for the disparity previously was that the PAs were under some kind of supervisory status and they now are no longer. So they're asking to be stepped back up. Is that just kind of historically understanding? Is that accurate?
Yeah, I think that's accurate. And Rachel, if there's anything you want to add to that, then please go ahead. But
I think it's a little bit of old medicine prior to changes when things were very supervised and our structure was a little bit different. And so old water under the bridge, I guess, so to speak, as we move forward, especially in rural medicine. So in Coos Bay, I have almost 3,000 patients in my practice. We've lost 4 providers out of my department alone in the last 6 months. And so what this does is it creates a huge barrier to care. I can't get these people seen in my community because they don't have anywhere to go. And so, especially rural, this is a big issue. And I think that wasn't kind of recognized way back once upon a time.
Yeah, I thank you for bringing this. I know that we've dealt a lot with kind of access to care, especially in rural areas. And it sounds like this would help that substantially. So I think that's be great to get the language back, but excited to see some more discussion on this.
Absolutely. There's such a shortage of providers. To give you an idea, some of the claims that I have are from Enterprise, Oregon, Hood River, Oregon, I-5 corridor, Southern Oregon, Northeastern Oregon, all the way out to Mower County, because they can't find providers that are culturally competent to care for these folks.
Oh. I see a hand from Dustin.
Yeah, just a question for Rachel and Taylor, if you guys have any of the background on this. When the legislation is crafted, and not have any medical background per se, the difference between a PA and NP, would there be anything written into the legislation that dictates that like certain severity of claim can't be done by a PA? Is that part of it? Or, I mean, essentially, would it just indicate that NPs and PAs, for all intents and purposes, are exactly equal within the work comp system, regardless of the types of claims, the need for surgical intervention, and anything that might need to be considered in that realm that would be defined in the legislation?
Taylor, if you want to attest to language, I can attest to clinical.
Yeah, I mean, our intent is not to have any of that separation. It really is just extending the time frame that currently exists in statute from 60 days to 180 days, seeing the patient, authorizing payment, all of the things that are outlined in statute. We're just lengthening the time to be comparable to what nurse practitioners have.
Okay, thank you.
Clinically, there's really not a difference. We can practice medicine. One's trained under the nursing model where PAs are trained under the physician model. So we equally prescribe depending on what's within your scope, right? So you wouldn't be practicing cardiothoracic surgery if you're an internist. And so referring still appropriate to specialty, but the equality across the board within your scope of practice.
Great, thank you.
You're welcome.
So any other questions from folks? Not seeing any, but I see Patrick has showed up, so shall I pass the baton?
Patrick is here now, yes, so.
All right, well, thank you very much, Scott, for taking it up as I was delayed on my drive in this morning. So sounds like it was a good discussion with commentary, and we'll go ahead and start again at the beginning of the meeting. I am Patrick Priest, the co-chair on the management side. And we have an agenda, and I'll go ahead and follow it. The first thing on the agenda is to review and approve minute. Did we already do the roll call and everything?
I've
All
done the
that's
roll
been
call,
done?
yes.
Okay.
And for the minutes, Sarah sent us one small typo that we will correct. It's at the 56-minute mark, and it's changing a reference to from 16 visits to 18 visits. It was just a typo. So
Okay.
we with that correction from Sarah, I think you're ready to go. And I believe you have a quorum now.
Good. There is a quorum. There
Patrick, I
is,
so move to accept the minutes as amended.
Okay, thank you.
Sorry
Do
if
we
I
have a
jumped your
second?
gun.
No, that's what I was going to ask. So thank you. And I see Marcy wants to second or have a question.
No. I just want to abstain because I didn't participate in that meeting in January, so I'm not going to vote.
Okay. All right. So noted. Is there a second to approving the minutes as amended?
Sure, I'll second the motion.
Thank you, Tammy. I have a motion and a second. Is there any discussion? Hearing none, I would ask all those that approve the minutes as amended, as noted by Kara, to say aye.
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 And any opposed to make the same sound. Okay,
And we
it
have,
passes unanimously
and Marcy with abstain.
with one abstention. All right, next item on the agenda is department updates. And the first is Workers' Compensation Board case law, if any.
Yes. I see that Robert Carrington from the board is on, but I don't believe they have any updates today. You can chime in if you have something, Robert.
Yes. Hi, this is Robert. Can everyone hear me? We don't have anything specific to offer today. Thank you, members. Again, our quarterly MLAC report, which contains, good summary of the cases from the prior quarter up through December 2022 is available, and we'll be sure to speak up if there is anything in the next for the next meeting. Thanks.
All right. Any questions from the caucus on cases out there? Okay, hearing none, we'll move on to the next item, which is the Workers' Compensation Division rulemaking update.
The only update we have is just, we mentioned that the medical fee schedule rules were coming out, and now they are published on our webpage, and they're open for public testimony. The hearing is on February 15th at 1 p.m. here in Labor and Industries, and we welcome input from anyone and everyone. So if you need contact information or a link to that, just let me know. But that's all we have in rulemaking at the moment.
Okay, any other comments? Okay, hearing none, we will move on to our 2023 legislative review. And from my pre-meeting, I understand the first Senate bill, regulatory streamlining, is not going to be discussed today, or?
Correct. Yes, thank you, Mr. Chair. The division had a public hearing on this bill last week in Senate Labor and Business, and the Oregon Travelers Association had some concerns about some specific language. We just met with them late yesterday about their concerns, and we're thinking through how to address them. So we like a little bit of time to get that sorted out before we come back to the committee, probably at the next meeting. So we're just gonna pen that one over till the next thing.
All right. Does anybody have any questions at this time, or they're willing to wait till our next meeting? Okay, seeing none, we will move on to the next item, which is Senate Bill 418, which requires subject employers to adopt policy allowing subject workers paid time off during shift to receive medical services related to workers' compensable injury. and that's sponsored by Senator Gorsuch
And
and AXME, and I believe we have a presentation.
yeah. Joe Basler's on, there he is. Morning, Joe. I don't believe that Senator Gorsuch was able to join us this morning. If his staff is on, chime in, but I think Joe is it today.
Yeah. Thank you so much for allowing me to join. I really appreciate it. I'm gonna be very honest. I am a workers' comp novice, and so please don't judge me too harshly. It's gonna be hard, right? Because you know this stuff very well, and I probably seem like an idiot. But I think I just want to start off by saying also that this was our first attempt at trying to solve a problem that our membership and had been bringing to us consistently for the last couple of years. And it is not like, this is the bill we're definitely going to move forward with, or we're going to be pushing really hard. But this is our first crack at trying to solve this problem. And the more input, the more feedback we get, I think we're happy to sort of, we already planning on setting some amendments after meeting with DCBS and giving us some really good, thoughtful input. So, really open to hearing anything both management and labor have to say about how we can make our bill better. But I do want to stress that this is coming from a place of workers who are mostly our members who are saying, like, I'm really being adversely affected by trying to get back to work, and we're trying to figure out the best way possible to sort of allow them to continue to do their physical therapy, get their doctor's visits once they've been cleared to go back on the job. Because right now what's happening is we have so many of our folks who have an hour physical therapy appointment. They're not triggering that 4-hour time loss. And so folks, if you have to do physical therapy 2-3 times a week, you're just like devouring your paid time off, your sick leave. And you've already lost a chunk for that first 3 days when you're off. And so I think what we're trying to figure out is like, how can we make sure folks are getting healthy? Because I think our members are saying, well, I can't go to physical therapy. I can't take any more time off. I can't lose any more leave. And so we're really worried that our members are, and I don't get just our members, we've heard this from other workers, that they're just not going to get their physical therapy. They're not going to their doctor's visits after they've been cleared to back to work. And that has long-term effects that they don't ever sort of get there. Sorry, I saw questions. I'm used to a legislative hearing, so like, feel free to like, I should reference the chair. I don't want to screw up.
Thank you very much, Joe. I did see a hand briefly be raised, and then they took it down right away. Maybe you answered their question. I don't know. But
I can't imagine I answered their question.
Sorry, I clicked the wrong button. Don't worry about my hand going up.
Oh, okay. All right. False alarm. All right. Well, Joe, I thank you for that brief summary and sort of qualifying what you presented. I will say that being the management co-chair, we had a pre-meeting just to kind of talk about what was being presented to us. And when we did, there were a lot of concerns brought up by the language as it was presented. And I guess I would call on members of the management caucus to maybe share some of the concerns that they had, unless they wanted me to do my best to summarize it. But we have some experts that handle claims settlements and are small business owners that will be very adversely impacted by this. I think I see Kirsten as well as a management stakeholder. Did you want to chime in to start?
Sure. Yeah, I don't want to step in front of any of the members if they want to start, but I'm happy to share some thoughts from the business perspective. If now would be a good time.
Yes, I think so.
Great. So thank you, co-chairs. Kirsten Adams with Associated General Contractors. Sorry for the background noise. I'm at a conference today. And Joe, thank you for some of that information on what your members are facing and so what the concerns are. We do have some concerns with the approach that's put forward in this bill. And didn't want to make extensive comments today because we kind of wanted to see what the goal was and sort of what you're trying to get at. And it sounds like you're open to talking about the solution and that sort of thing. So we just want to flag two main concerns that we have with the bill that we think kind of go against two of the main tenets of the workers' comp system, the exclusive remedy and then the workers' comp as a no-fault system. So from the exclusive remedy perspective, we are concerned that by requiring employers to pay for a new benefit outside of the workers' comp system, that it breaches the exclusive remedy of workers' comp. The idea behind workers' comp being that it's the system to deal with all issues related to workers' comp. So we feel like by adding an additional piece, to the employer, it kind of goes to going outside of the workers' comp system for that. And then the other piece being workers' comp is a no-fault system. It feels to us by requiring the employer to pay for the time the employee misses for work treatments, it's seeming to sort of assign faults to the employer. And so we have concerns about that because I think part of what makes the workers' comp system work so well is that it doesn't really matter how you got into this situation. It's here to care for you and here to make sure that the workers get back to being whole. So I think by putting some of these changes into place, it sort of goes against that initial tenet. But I also, one of the things that's most important to all of us is that the workers get the treatment that they need and, can get back to whole and back to work as fully as they can. And so, I think looking at how to help with this situation is important. I just have some concerns with the approach of this. And happy to answer any questions. And, I'm looking forward to having more in-depth conversations about this. I didn't want to come out with too many things ahead of getting to hear what you all were looking for and what your goals were. So, but hopefully that's sort of helpful to hear from the business perspective of some of our concerns, and, look forward to working more on this issue.
No, that is very helpful. I think hearing that, I'm tracking the logic of what you're saying. I think that makes a lot of sense. My only one comment back is like, I do think folks aren't, like I said, if they can't afford.
I'll reach out to him this afternoon.
Oh, sorry. I thought it was out of order. I was getting shut down. I was going to say that I think that like if folks, like, if workers don't have the ability to actually go and get whole for financial reasons, then I don't know how we're getting folks back to work. And so I think that's the part that like I don't and how we pay or who pays, we should figure that out. I just want to make sure that we're, like as you said, no fault, like worker, we also want to make sure that they're not suffering and unable to get to the health level that the best health level they can reach, because they can't do that physical therapy that they need.
Yeah, that makes sense. And I think you're exactly right. The no fault cuts both ways. So making sure that, there isn't any part in the system that's, assigning fault. But I'm seeing management members with hands, so I'm going to stop talking.
Thank you, Christian and Joe, for your response. Sarah is first on my screen with her hand up, so I'll let her go first.
Thank you, Patrick, and thank you, Joe, for this presentation. We appreciate hearing problems that are out there and how we can deal with them. So I guess I'm not sure who this is aimed at. Is it aimed at workers that were off work on time last, that have many appointments? Like, who are we trying to target with this?
I think we're trying to target folks. We're trying to target folks who've got their workers' comp claim, have maybe been off time for a while. Maybe they haven't been off time very much at all, but they've been cleared to go back to work and that they are working, but they still need to go and continue to get treatment to recover to, I won't say fully recover because some folks won't, but get back to the highest level of recovery that they can. So, I mean, I think that's who we're really looking at, is those folks who are working, are having to take time off the job they've been cleared to go back to, but aren't hitting that, especially that 4-hour threshold, are missing 2 hours, 3 hours, and they're having to take their own leave to cover that time. And as I said, if you're doing that twice a week for 6 months, that's a lot of time out of your bank.
Thank you for that, Joe. What we were presented with is very ambiguous and open-ended, and so I think drilling down would be extremely helpful, so we understood what we're really looking at and trying to target.
You okay?
Thank you.
And I would just say, I would never legislative council are fantastic. They are so smart. They do so many jobs. I could never do what they do. But then sometimes it's like my fault. Like maybe I was too vague when I made my request. So I blame myself. I apologize.
Don't be too hard on yourself, Joe. All right, I see Tammy with her hand up as well.
Yes, I do have a few questions. Yeah, Joe, don't be too hard on yourself. A lot of times it'll come in a legislative concept and then, before the bill is made. And like Sarah said, it is very broad, it's very open. And so well, first of all, I want to know where you're from. What company are you with? Because you've talked about your members.
Oh, sorry. I'm with a union. I'm the associate director with the American Federation of State, County, Municipal Employees. So, and I know that's this would cut across both public and private sector workers, but I think but AFSCME is I would argue probably one of the most diverse unions in the state. We represent, Harney County Road Crew, but we also represent the research assistants at OHSU, DEQ scientists, but then also we represent childcare providers who are registered and certified, or behavioral health workers at Cascadia Mental Health. So we're all over the place. We have a diverse. It is mildly stressful. To one day I'm getting yelled at by corrections officers, and the next day I'm getting yelled at by childcare providers, and so that's we kind of bounce around a lot.
Sure. Okay. No problem. I was just wondering when you were talking about like your people that you were representing, if that was a union or not. So thank you for explaining that. So this is very broad, and I have some very specific questions. Normally, if an injured worker, misses work, maybe they have some injections and the doctor has them take the whole day off. They have injections in the morning and they miss an entire day of work. The insurance company pays time loss for that entire day. But the way that this is worded, the employer would have to pay wages for that day. It takes it away from a certified claims adjuster and given to an employer. And so that's a concern of mine. And if they do miss more than 4 hours of work, then the insurance company pays. But this takes away that. It's not like targeting just those first 4 hours. And I very specifically have concerns regarding the 3-day waiting period, because normally somebody's hurt and then they leave work and they go to the doctor, and maybe the next day they have to have x-rays or a scan or something. And so that's part of the 3-day waiting period. But the way that this is worded, then the employer would have to pay 2 full days of wages during the 3-day waiting period. And that's a major concern of mine. And so I don't know if that's something you want to talk about now, or work on with your people and come back and address, but those are my concerns.
No, I think it's something I definitely want to go back and talk to my people and work on. I hear your concerns. I obviously I think they're important. I think we'll need to address them. I would say that I think with most workers, I can't say everyone, I don't know everyone, but most workers, I think the 3-day waiting period is a significant shock to them. I think that folks, I would also say that one of the other thing is, as we've been talking about this issue for the last 6 months, it seems like a significant shock to folks that what do you mean I don't get covered for the 2 hours I have to go do my physical therapy? I think there's this level of workers don't understand what workers' comp actually covers. When they get hurt, they just think, I got hurt on the job, doing my job, I'm going to be covered. And so they don't plan for it. So that's just a long way to say that, yes, I hear your concerns. I think I want to talk to our folks and figure out what's our solution. And I'm happy to bring it back and hammer it out.
Thank you.
Are there any other questions from the caucus? I know one that I had, we had talked about a little bit, is we have new laws, paid leave laws in Oregon, paid leave Oregon, coming up that is still kind of being, hammered out. I don't understand it entirely. I don't know. Maybe the people here from DCBS can answer the question, but How would this relate to that? Would some of this already be covered under those new leave laws?
I think our desire was to keep it as separated from the new leave laws as possible, because to be honest, I think there's like 4 people in the state who understand the new leave laws, because they're the ones who are writing them and implementing
Are they
them
in the room?
as we speak. Yeah, maybe these, I should, it's probably Teresa. Teresa is here.
Yeah.
I actually sadly know, because I had to work on this for 3 sessions for it not come to DCBS. I believe, and I will check the enacting legislation as we continue the conversation, but I believe this has been consistent all along through the various reiterations of this, that the paid leave that's taken from this program cannot be concurrent with an accepted claim. They are separate. So I will verify that with the, because I believe that was in the acted law, but so I'll check on that right now.
Okay, so it would be excluded by it.
They have to be separate. So if somebody has an accepted claim, they cannot, do a double fill, if you will, with paid leave or leave.
But maybe during the waiting period? Could it be during the waiting period?
I'm not sure. I can send an email and ask and do a follow-up for the committee with the paid leave Oregon staff.
But Patrick, just to clarify, Oregon sick leave would
cover it. So,
Mhm.
But there, I think it's specifically, Joe, the intention to not make it part of sick leave. You want this to be a new bank of time that employers would be compensating.
I would say, like, we definitely don't, we I think a workers' comp injury, we would like it to have as least amount of effect on folks' sick leave as possible, because once it's deleted, so say you're having those physical therapy appointments 2 or 3 times for 3-6 months, and your leave's gone, and then your kid gets sick, or you get sick, just regular sick, not workers' comp sick, but like, you get, my 4-year-old is in the other room with norovirus. She's passed out, don't worry. And luckily I have a job where I can be on Zoom, but I think that's what we're trying to solve, is like I think to Kristen's point, the no fault, like trying to make sure that folks aren't destroying their sick leave that they might need later on. Maybe they need it for FMLA, maybe they for other leave. We don't want it to be gone when something else comes down the road. So I think that's the way we're looking at it. Whether or not the employer pays or how we figure that out, I think that's still an open question that we want to still get some clarity on.
I do have an answer. So yes, to verify, so this is in section 6 of the enabling legislation. So in any week, an employee is eligible, so when accept a claim and they are receiving time loss benefits, they are disqualified from receiving paid leave Oregon benefits. But Sarah is correct. They can use sick leave in that time, and they can also continue to use their sick leave or other PTO paid time off in concurrence with paid leave Oregon benefits.
Okay, all right, thank you for that clarification. We have one of the 4 people that understands it right here, so thank you.
Might be 7 or 8.
Yeah. All right, I see that Scott has his hand raised. I'll let him ask a question.
Yeah, I guess just a quick question. So I hear a lot of the concerns on management side, and I probably share Joe's feeling that I'm outgunned in my understanding of workers' comp with a lot of the folks that do it on a more professional level here. So if I'm hearing this correctly, I mean, this sounds like a critical issue, access to care, that kind of ongoing discussion that we've had, and workers being disincentivized from having those ongoing meetings when there's already the disincentives. I know we just heard from a physician's assistant talking about the kind of crisis of providers and getting folks in to see people. Is there a kind of suggested remedy or approach that management would like to see or feel more comfortable with? Is it, and kind of furthering that discussion, am I hearing kind of the exclusive remedy concern? So really making sure that if this is a workers' comp issue, that it's the insurer that is covering that? Is that sort of the feedback from management? Or I'm trying to kind of wrap my head around the issue, and I know that we want it drilled down and specified, and I would agree, but I'm trying to kind of get a read on what that would look like.
Well, as the chair and attending the pre-meeting, I think it was more about the problems than solutions. Was what we were really, kind of identifying some of the broadness of it. Really hoping to understand what the issue that's being tackled is. I think if it's broad and some of the things that are perhaps unintended consequences of the way it's worded is, there's quite a big potential cost to employers. And I don't know if there's any sort of thought given to how many appointments is this? I mean, are we able to gather that kind of information? How many hours of time would have to be paid by small businesses and Harney County, which I know people in Harney County, they don't have a ton of money to be paying extra for things. I mean, that would be a challenge for local government as well. So I think trying to get our arms around what is the ask of management in terms of costs would be nice to have clarity around it. I see Tammy has her hand raised. Maybe she could say it more artfully than I.
No, I can't. No, you're right. We kind of discussed some of the issues we had and not any of the solutions we had. And, not affecting the 3-day waiting period is a big issue that I can see for the entire state of Oregon. I mean, you're changing a workers' compensation system that has been in place. I don't know how long Sally might be able to tell us, when that began and why it began. I work with multiple states in the nation, and every state that I know of, I don't know of a single state in the nation that doesn't have a waiting period. And like the state of Tennessee has a 7-day waiting period, for example. So I certainly wouldn't want to do it away with that or affect that in the state of Oregon. And after somebody's off work for 14 days, they go back, the insurance company goes back and picks up that 3-day waiting period and pays the worker that 3-day waiting period. It's like an insurance deductible. And so to have a worker, get paid by their employer is like removing their insurance deductible. So I just kind of wanted to comment a little bit more on that. But also, Joe, another way that the bill is written, it says, workers' compensable injury. So if it's an injury that's not yet accepted, it might not be accepted after 60 days, then you're going to have the employer go back and figure out everything that they owe. And then, WCD, this DCBS, they do audits annually of the TPAs and the insurers to make sure benefits are paid timely and correctly. And so is DCBS now going to need to go in and audit for the employers to make sure that they are paying this, timely and correctly. So that's also a big issue that I would want to know, because we don't have claims adjusters for the employers in the payroll. We don't have claims adjusters there. That's why it needs to stay with the insurer.
No, and I would say, sorry to interrupt, DCBS actually pointed that out to me in the bill. And that, like I said, that wasn't our intention. Is for folks who've had their claims, they have their claims and then they're trying to come back to they're back to work and they're having to take time off, is was sort of like the space we wanted to be in. So I heard that, and that was something we have to work on.
Okay. And it just seems like it nullifies the laws regarding the 4 hours. And so if you're talking about the first 4 hours and not the second 4 hours, that might be another issue. All right. Thank you, Joe. Sorry.
No problem. I would also say that, pay time off is also like a lot of folks use that's sort of like they don't have a lot of other benefits. A lot of times that's one of the things they use is sort of like their bank to sort of protect themselves and their families, and it's super vital. So and the loss of that is more significantly emotional than I think a lot of folks can appreciate, especially for a lot of our workers who have fought so hard to get them.
Tammy, did you have another question? Comment?
I do, but Scott's hand was raised before me. But you took it down.
His hand is not raised. Maybe
It was. Okay. So Joe, one more thing. So I don't know if I'm reading this right or not, but when it talks about that the subject employer, shall pay the subject worker their wages when they miss appointments, it doesn't distinguish if they're back to work or not back to work, if they're on full time loss or already returned to work. That's another thing that's not carved out. So, I mean, I would hate to have somebody on 100% time loss, but because of this rule, the employer has to pay, these hours and keep track of all their appointments instead of the certified claims adjuster with the insurance company.
No, it's an excellent point. I think that was not our intention.
Okay, thank you.
No problem.
Kristen, I see that you've got your hand raised.
Yeah, I just wanted to respond a bit to Scott's, and I think my response is similar to the one you just got of that, we wanted to kind of figure out exactly what the problem was. And, but I would like to, from the management stakeholder side, say that we, appreciate the chance to sit down and talk with you, Joe, about maybe a way to deal with this within the system. If there is a way that we can work towards solving this problem. And so anyways, just wanted to commit to that I don't have any solutions right now because I, kind of needed to gather more info on exactly what the goal was, but I'd love to be part of a conversation about trying to figure out a way to deal with this issue.
Thank you, Kristen. Joe, is that okay? You're kind of quiet now. Would you be willing to meet with them?
Oh yeah, for sure. Sorry. Yeah, absolutely, Kristen. I'm happy to talk.
All right, I see some hands raised. Jill, I'll let you. Kristen, do you still have your hand raised? Are you done? Oh, you're okay. All right, Jill.
I'm done. Sorry, I'll put it down.
All right, thanks.
Thank you. I just wanted to say thank you to Joe for bringing this forward, because I think that is a pretty legitimate concern for the employee to be needing to kind of, use their time off to be able to take care of themselves and try to heal and get back to that 100%. And because I'm also with Scott with not knowing a ton of the intricacies of all of workers' comp, being more of a lay person when it comes to this, but just having that view, that PTO time off is pretty valuable to the worker. And I think that this could be a really good issue for us to try to look into and find a good way to remedy it, because it could not only is it going to, I think, help that worker, stay up with their appointments and whatnot, but then also be able to meet their appointments and put in as much working time as they can and not have to draw out to try to get to that 4-hour point. So I think that, looking at the options, it could be a win-win for both sides, with getting that worker the help they need and having them be able to continue to contribute. So thank you, Joe, for bringing this forward.
Thank you.
Thank you, Joe, for your comment. That was nice to hear from labor. I see Keith Semple has his hand raised.
Hi, Keith Semple with Oregon Trial Lawyers Association. I just wanted to thank Joe as well for bringing this. I think it's really timely because we just spent a lot of time talking about worker engagement with providers and some of the barriers to that. This concept actually kind of came up a couple of times in that discussion, and we had briefly considered legislation on that would be good, but I'm glad to see that someone's bringing it for this session, and we definitely want to be part of any conversation on this to assist, because this is a huge thing for workers. If they lose all of their PTO, then they're vulnerable to being dinged for attendance issues and everything else. So, and it's hard-earned money. It's really hard-earned money for workers to get PTO. Some workers have to work a lot of hours to accrue PTO. So it is an important issue, and we look forward to talking about it. Thank you.
Thank you for your comments. Are there any other comments, questions, or concerns? So I guess maybe, Joe, maybe just let us know what the next steps are, or will we be hearing back, or is there anything that we should be asking for from DCBS in terms of research or?
I think we're hoping to have a meeting with some of our partners next week to start figuring out where to, frankly, taking your feedback and sort of hammering out what we think where we want to go. Happy to bring it back, share it with the board members, both sides, and sort of like where sort of answer your questions, flesh them out a little bit. And I think yeah, the more we can work on coming up with a solution, I'm very happy to. We want to make sure we get some resolution for these workers, and it's better to come up with a compromise everyone likes and actually passes versus a giant fight.
All right, well, thank you very much. I also appreciate you bringing it forward and being open to all the ideas and to talking with the management stakeholders as well. I thought that was very nice. All right, and I see that we have a couple of additional hands raised. Scott is the first.
Yeah, having to go through the process of working with LC on bill language and whatnot currently on a separate issue, I can appreciate that. And I was going to say, I don't know if there's any folks from the insurer camp also that want to jump in. I see Dave Barenberg has his hand up. Just wanted to flag, I know we've heard a lot of really good feedback from employers. It's kind of helping me start to wrap my head around it, that I think could be helpful maybe for Joe as well in going back on this issue. So I'll yield. I see Dave Barenberg, but I don't know if there's anybody else too that has concerns or ideas.
Okay. Go ahead, Dave.
Yeah, thank you. First, Joe, feel your pain with council. That the way this came out and drafted, I think it raised the blood pressure of all the insurers and everybody on the management side. And just one nice thing I think about the MLAC process too, and just to give some credit to the business representatives, is rather than sort of go ballistic with the words that were written, there was clearly the sense of let's hold our powder and hear what the sponsor has to say and what their intentions are, so that we can then start figuring out what the issues are and working together. So I think that when we did some just initial analysis as the bill was initially written, it's so broad, it would be incredibly expensive, hard to administer, and just had a lot of questions. But we are very happy and willing to sit down and try to address these issues, because clearly the shared interest we all have is making sure the system works to get injured workers back to their full potential and keep them in the workforce. So I think we share that goal. I see this bill just got scheduled, for a hearing, I think on Tuesday. And, I'm hoping that the joint message that we can all go in with is, we're talking about this, here's a heads up on what the issue is. And, we'll work on the process and, through MLAC and others, and try to come back with a solution, rather than having a hearing where we focus on the words on the page. But look forward to working with everybody, and SAFE is very happy to jump in and produce data and other things to as we move forward in discussion.
And we're happy to pull a meeting together around the bill with both AGC, SAFE, whoever else is interested, to talk through it. And our intention is very. I hope I've been clear. It's very much that, like, this is the problem we were trying to get at. This is the first draft that came out from Legislative Council. As I said, maybe I didn't explain it well enough. And that we're very focused on trying to protect those workers so they can get healthy and keep working and reduce the cost long term. And so figuring out the best way to do that, I think we're super open to it.
Thank you. Any other comments, questions, concerns? I think we'll be hearing more about it. Maybe just one last question that I have, Joe, is there a reason why it didn't want to be left in the work comp system entirely? Why a new category of benefit of a new leave outside of comp, outside of?
Oh yeah, we sort of laid out the problem and said we'd like to figure out a way for folks to not have their leave burned while they went to physical therapy or doctor's visits after they've been back to work. And yeah, so not my intention to create a brand new system under the law. There's a really good chance I'm going to accidentally create a new agency at any moment.
Yeah.
Every time I roll down there. So, you know.
I really, that was a diplomatic answer. I really appreciate that, Joe.
Yeah. It's like, frankly, it's only a matter of time before I accidentally, you know, I might create a new branch of government. It'll be awesome.
Yeah. Thank you. David, did you have your hand raised again, or is it left over from before?
User error.
Okay, all right, well, thank you. Thank you for that. Well, since I believe the last item on the regular agenda was done first.
Yes.
Is there any other business to bring before this particular meeting from DCBS or administrators? Work comp division, from anybody on the call? Any caucus members want to hang around a little bit longer, talk about stuff? Okay, all right. Hearing none, I would ask if there is a motion to adjourn the meeting.
This is Marcy. I move that we adjourn the meeting.
Thank you, Marcy. Is there a second?
I'll second the motion. This
Thank
is
you,
Matt.
Matt. All in favor, say aye.
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 Any opposed? All right, well, the meeting is adjourned and our next meeting is
February 17th,
February 17th.
2 weeks.
So thank you very much. Have a
Thank
great
you,
day,
Joe.
everyone.
Thanks for coming, Joe. Bye, everyone.
Thank you,
Bye.
Joe. Bye.